Hi again, ladies and gentlemen. Welcome. Well, today we are going to discuss on a very new disease, which is acute radiation syndrome. And this one is more or less acute, as per se, as its name describes, because it is caused by high dose of exposure to radiation. So it is more or less complicated. So to start with, we have the important properties which are more or less rapid onset of symptoms on exposure to radiation greater than 1 gray as per measurement of radiation, and the severity of ARS also depends on the dose of the radiation. How severe it is, it depends on the dose also. So that's it. Then for the life cycle, it has 4 stages of the life cycle, which are the prodromal stages, the latent phase, the manifest phase, and the recovery or death phase, wherein either the patient will succumb or is cured from the radiative disease or radiative sickness. Now let's go to the pathogenesis, which includes destruction of our rapidly dividing cells, particularly bone marrow. So that's how it works. It destroys rapidly divided cells, which are particularly related to the bone marrow. Now for the clinical features, we have the hematopoietic syndrome, which more or less deals with blood. Deals with bleeding. Also, we have GI syndromes, which occurs due to nausea and vomiting. Also, we have cerebrovascular syndrome. The cerebrovascular syndrome, we have the seizures, and even lead to ataxia. Ataxia can also occur. And for the laboratory diagnosis, we can do two main tests for the laboratory diagnosis, which are the complete blood count and the bone marrow biopsy. These are the two tests we do in the laboratory to make sure that we are actually able to diagnose this one. For the treatment, more or less, we have 3 methods in which we treat this one. One of them is the fluid and electrolyte replacement. You have to replace the fluid that has been lost during the process of bleeding, and also antibiotics against bacteria which will be invading due to immunocompromised situations. Also, bone marrow transplant is also very important. Bone marrow transplant. And lastly, prevention and cure. So how do we prevent such diseases or infections or particular illnesses? One method is to limit exposure to X-rays and personal protective equipment. So thank you for